how we're using this to help patients, help doctors, help monetize the processes you may already be doing, but also to improve the outcomes for your patients as well. If you're monitoring chronic care patients right now, there's a good chance you're already qualified for thousands of dollars a month in RPM and maybe RTM revenue. You're not billing for most of it because you just don't have a process to do it and document it. In the next 5 minutes, I'm going to show you the portal that finds that revenue, keeps you compliant, and gets your staff their time back. Most practices are still tracking this by hand. They're using spreadsheets, they're sticky notes. Someone's trying to remember who hit their 20-minute threshold for billing it this month. Somebody's trying to keep track of who called who. That lost revenue and time every month, and it's an audit risk if you can't document it. Connect replaces all of it with one portal built specifically for our RPM and RTM. Every reading your patient sends in, every, we call it alert, every message, blood pressure, weight, daily check-in, lands here immediately. Your staff sees it at a glance with ones that are routine and which need attention today. We don't know sometimes what they are, but they have the option of sending out an SOS or a safe message and what that customized message might be. We can escalate that right through the process of working on each patient, and we can send that number directly to your practice in another message portal if you need to. Most doctor offices have a text message that they keep track of for patients, and we can incorporate that as well. I'm going to show you a quick live action demo of this as I go through it. In that process, you're going to see that I send a message directly to this portal. You're going to see me send one that says, I took my medication. I'm going to go through that process of showing it on the portal. And then on the portal, you're going to see that that comes out immediately, and it gives me a way to manage it right there in the system. Every patient is matched to the codes that actually fit their diagnosis. So you're never billing RPM or RTM against something that isn't documented. Logging your time takes time in your practice right now. We can do that through the portal and in seconds, document a call, a message review, a discussion with them about medication, a care coordination note, whatever that might be. Connect tracks all that time and minutes toward the thresholds that they need for billing. And to be straight with you, this isn't an FDA-approved device. It doesn't need to be. It doesn't diagnose anything. It doesn't connect anything. It's a documentation and workflow engine that keeps your billing defensible and keeps your patients engaged during their treatment or their recovery. That's important. Here's what matters most. This is real test data. There's 50-some patients in here. You'll have anywhere, depending on the type of practice. I've got practices that show anywhere from $100 a month per patient, depending on the kind of business they're doing, to more like $180, $190 per patient per month on the types of billing we can do per patient using this approach. Okay. On average, a practice with 100 qualifying patients could have over $100,000 a year in RPM and RTM revenue to things they may already be doing, but they're earning enough due to a lack of process or documentation, so they just aren't capturing it. Connect shows you what's out there, what's open for that patient, what needs to be done to bill for it, and it improves the communication between you and your client because of the prompts we give them to send in information. We want to use conservative numbers. You'll see that in our presentations. We want to make sure you stay compliant. We make sure we're not doing anything to look like we're inventing business that doesn't already exist. We really think that patients' records of actions between visits has gotten doctors' attention, but they don't have a way to track it. Maybe they tell a patient to just put it on a sticky note or write it on a piece of paper. We had nephrologists saying that they asked their patients to take blood pressure or other data points between visits and write them down. Bring them in during your next appointment, they said. Well, that's not really effective, efficient. Doesn't improve care if things are happening between visits that aren't getting addressed. One of the reasons we built this was because we had an OBGYN we were working with, and before they had to get Active SOS or Connect, she didn't have a way for the patient to keep track of postpartum symptoms. She didn't see the trend of her blood pressure spiking. The patient died of a stroke with a newborn and a 2-year-old at home. The doctor was a friend of one of our people on the Active SOS initial development team. Immediately we knew we had a tool that could keep her engaged with their high-risk patients and improve outcomes whether she was able to monetize it or not. By having the portal and the easy way to complete pictures of patients over time and between visits, that data can be critical to reducing bad outcomes. Connect gives us a plain English summary, trends, vitals, what changed since last month. You'll see that in our AI report we make for each patient, your activity that doesn't just look like raw data, it looks like a true workable summary that doctor can read and use the next time that patient sees them in the office. Real-time data that matters, not just paperwork or outdated data like writing it on a piece of paper or sending me a sticky note. One portal, better patient outcomes, less administrative overhead, and revenue you're already earning but not collecting. I'd like for you to book a personalized walkthrough for your practice at activesos.com/call. My name is David Zink, where you can reach me directly at david.zink@activesos.com. That's david.zink@activesos.com. We'd love to help your practice, show you how this works specifically in your situation, and whether it's strictly for the RPM and RTM revenue or it's just to help your patients, we think we can help. Thank you.